Allergy sufferers like myself are well aware that season is here. Yeah, I sneeze a lot in the newsroom. So with a refresher course on how to win the war with allergies, or at least fight a better battle, Dr. Jared Darveaux joins us this morning. Dr. Darveaux, so first off, what kind of scope are we looking at as far as the battle goes? What causes these fall-time allergies?
Well, you know, when we get into the fall season, weeds are pollinating, and so those are typically what cause problems for people in the fall. You know, ragweed in particular is one that really bothers allergy sufferers. And this year in particular, as you heard, it's been extremely muggy and humid, which is prime growing conditions for molds. And so molds can be a problem for allergy sufferers as well.
That's what I love to hear.
So what are some of the things we can do to reduce our exposure?
Well, exactly. Reducing exposure is the number one way to prevent allergy symptoms. But if you can't, if you have to be outside, when you do come into the house, if you've been out all day, try to take a shower, get that pollen and things out of your hair. If you are in the house, keep all of the doors and windows closed. That keeps the pollen from coming in through the windows and bothering you inside your home as well.
Okay, we tend to see a lot of different allergy medications advertised, new ones popping up every once in a while. Do we know which ones work better?
Well, if you're just having mild symptoms, you know, a little bit of an itchy nose or itchy eyes, the over-the-counter antihistamines work pretty well. So there are Zyrtec and Claritin and Allegra. Those are probably the most popular. If you're having more symptoms of nasal stuffiness and congestion, sometimes those antihistamines aren't enough, and using the nasal steroid sprays like Flonase, Nasacort, both of which are over-the-counter, can be helpful as well. The key with those is that they don't work very quickly, and so it can take a couple of weeks of consistent use before you get a lot of benefit out of them. So don't just use them for a day or two and then put them away because you think they're not working.
How do we know the difference between allergies, or if you're really sick and maybe should go to the doctor?
Well, if you're having symptoms of a fever, if you have discolored drainage from your nose, if all of your symptoms are on one side of your face rather than both sides, those would be more symptoms of a sinus infection or a cold, and that would be a reason to call your doctor.
All right, Dr. Darveaux, we want to thank you for helping us arm ourselves in this battle against fall allergies this morning.